E-cigarettes are nearly 2 times as efficient as nicotine addiction replacements for help smokers abandon, a research suggests. A test found 18% of smokers who utilized them to abandon remained fume-free following a year, compared in 9.9% of such with nicotine addiction replacement treatments. The research of 886 smokers is the at first to testing how efficient contemporary e-cigarettes are for exit. Researchers expect their received information will conduct to vaping devices creature regularly proposed by Halt Smoking Services. Yet, up before now down there had been a lack of testimony on how efficient they were as Halt Smoking Toolkit. Conduct investigator Professor Peter Hayek, of Tsarina Mary College of London, told, though a big quantity of smokers paper how they include abandoned smoke effectively in the assist of e-cigarettes, public health professionals include been unwilling to encourage their use since of the absence of precise testimony of randomized controllable testing the is now potential to changing. Attending in the test, who were dependent on smoke and had previous unsuccessful to offer up, visited NHS Halt Smoking Services and were randomly specified in 2 groups, such taking into account e-cigarettes were emboldened to buy next supplies of their own selection of strengths and flavoring additives, and all attending acquired week A on a behavioral supporting for at low 4 persons weeks. E-cigarettes as well stipulated high gratification and were nominal as more than useful rather than nicotine addiction replacement treat. A high ratio of such who utilized the devices skilled jaw and neck annoyance, 65% v 51%, though human beings with the nicotine addiction replacement treatments were more than potential to paper sickness, 38% v 31%. These effects were generally soft. Professor Hayek told he hoped the results of the research would conduct to Halt Smoking Services offer quitters an e-cigarette starter motor package and guide on how to vape, following that they could pay for their own supplies. The may eventually future speed the reducing in smoke and in smoke-related diseases, told Dunya Perzalj, else writer of the research, as well of Tsarina Mary College of London. The research has several limitations. Since human beings had named that treat they had acquired, as opposed to creature dazzled as they are in largest randomized controllable testing, it was probable attending may include perceivable nicotine addiction replacements as in lower stock option and put less than force in exit, the authors told. They as well told more than job was necessary to define if their results would use to countries external of the UK and for less than dependent smokers. The research comes following an freelance overview of testimony on e-cigarettes, by Social Public Health England, published in February recent year. Signed down there was insurmountable testimony they were far more secure rather than smoke and of insignificant hazard to bystanders. Responsible to the newest study, Social Public Health England told, all Halt Smoking Services should greet smokers who wish to abandon in the assist of an e-cigarette.